Every 36 seconds, someone dies of heart attack in our country. Many of those happens at home. But here is one thing which most people do not know. 70% of this death could be prevented if we follow some simple home-based guidelines. So as a practicing cardiologist, I have seen time and again that too many families lose their loved ones because they do not know what to do in case of heart attack when it happens at home. So today we are going to discuss about that with an experience of around 25 years, and today I'm going to discuss about few important steps regarding heart attack or chest pain which is happening at home, so that you could save yourself or your loved ones. So before that, what is heart attack? The heart is, as all of us know, is a pumping station which pumps blood all over the body. So since heart is a pumping station, heart also requires its own blood supply as a source of nutrient. And this nutrient, heart gets it from three blood vessels which supplies blood to the heart. Heart supplies blood to all over organ, but heart also has its own blood supply. And these blood vessels which supplies blood to the heart are known as coronary arteries. So there are three coronary arteries. There are two left-sided coronary arteries and one right-sided coronary arteries. And heart attack happens when there is a block in the coronary arteries. So that is heart attack. What do you mean by block? Actually, the block is a thrombus. Thrombus means blood clot. So suddenly there is a blood clot in one of the vessels of the heart which causes the blood flow in that part of the artery to come to almost zero, and thereby the heart doesn't receive any blood supply. And that part of the heart which doesn't receive the blood supply because there is a cutoff of blood flow, that part of the heart muscle undergoes necrosis or death. And this necrosis or heart muscle dying happens very fast. So if you do not act urgently, the heart muscle will die. It is said that with every passage of time, the heart muscle dies, and its process starts within 10 minutes. Suppose somebody gets a heart attack, chest pain has started just now, and chest pain is secondary to heart attack. The heart muscle damage starts within the first 10 minutes. Within 1 hour, most of the damage is done. But still, during that time, if you do a timely intervention, the damage could be minimized and heart muscle could still function properly later on. But the damage becomes irreversible once it is beyond 3 hours or so. So that's why timely intervention is very important in case of heart attack. With every delayed treatment, the mortality or the death rate increases. The heart muscle dies and the complication of the damaged heart like heart failure increases substantially. Research had shown that every 30-minute delay of heart attack treatment, the mortality increases by 7.5%. So every 30-minute delay, the mortality or death rate increases by 7.5%. And if you give a timely treatment, the death rate could be minimized to the extent of less than 3%. But if the timely intervention is not done, the death due to heart attack could be as high as 50%. So that's why it is important on our part to recognize the signs and symptoms of heart attack and to take emergent treatment for that. So if you like our content, kindly subscribe to our channel and like and share it to somebody else. So what are the symptoms of heart attack? The symptoms of heart attack are predominantly chest pain. The chest pain will be in the middle part of the chest, which will be heavy, burning or squeezing. Along with the pain might radiate to the neck, jaw, left arm, shoulders, or sometimes even to the back also. And the pain is very severe, so much so that the patient is not able to talk. Sometimes the pain is associated with other symptoms, like patient can have shortness of breath, patient can have diffuse sweating, patient can have palpitation or giddiness, or sometimes the patient can have loss of consciousness also for transiently. So these are the few common symptoms of heart attack. Usually they complain of chest pain which is very heavy, as if an elephant has sat on the chest. So these are the common symptoms of heart attack. But sometimes heart attack can happen without chest pain also, especially in women, especially in diabetics or kidney failure patients or very elderly patients. In those group of individuals, heart attack may not be associated with chest pain. In those group of individuals, they can have only shortness of breath, they can have only fatigability, they can have only palpitation or profound sweating. So these are known as atypical symptoms. That means in this group of individuals, even though there is a heart attack happening, but patient may not complain of typical chest pain. So that's why in this group of individuals, the recognizing the symptoms are very important. Suppose a patient is diabetic, the patient may not complain of chest pain. He or she can complain only of shortness of breath, or can complain only of fatigability, or palpitation or profound sweating. So if all the symptoms are there without even chest pain, still you need to be mindful of the fact that patient might be having an heart attack. So these are the common signs and symptoms of heart attack which you need to understand. So very commonly they will have chest pain, so much so the severe sort of chest pain, and sometimes it's so severe which is probably they are experiencing this for the first time in their life. But still, in spite of this pain, majority of them tend to overlook. They tend to think this pain is because of gas or acidity, and then they tend to delay the treatment. They tend to take gas medicine thinking that pain would go off. This is something which is very, very dangerous, because as we have discussed previously, time is muscle. Time is of essence in case of heart attack. The more delay you do, the more damage is done to the heart. The survival risk, the survival rate also comes down significantly. So if you are experiencing a chest pain which is happening for the first time, very severe, with shortness of breath, with palpitation, with giddiness, you should be mindful of the fact that you might be experiencing a heart attack. Do not delay the treatment. Do not ignore these symptoms. Do not think these are due to gas or something else. So recognizing the signs and symptoms are very important. After recognizing the signs and symptoms, the first thing you should do is to call for emergency help. If you're alone at home, call somebody whom you know, whom you trust, your family members. If you are not alone at home, call that person near to you, ask for an emergency contact number of the hospital or an ambulance number. This is the first and foremost thing you need to do. And if you are a caregiver to a person who is experienced a chest pain, you should calm him down. You should ask him to sit, preferably on a bed or a chair with a propped up position. This reduces the strain on the heart and chances of damage to the heart is minimized. So ask the patient to sit on a bed or a chair, loosen his cloth so that his breathing becomes easier, and calm him down. Apart from that, the most important thing is to give him an aspirin tablet. Tablet is something which is the most important part of the emergency medical treatment at home. Aspirin is basically a tablet which has the capability to dissolve the clot. As we have discussed, heart attack is because of there is a clot in the blood vessels of the heart, and because of this clot the heart muscle undergoes damage and causing permanent damage and heart attack. So if you are taking an aspirin has the capability to dissolve the clot, and aspirin alone can decrease the damage of the heart attack by almost 25%. So aspirin is one of the most important therapy, and aspirin is very inexpensive. Everyone should have an aspirin in their home as an emergency kit. And aspirin, how do you take it? Aspirin ideally should be chewed rather than swallowed, because if you chew the aspirin, the absorption is faster. So that's why aspirin should be chewed rather than swallowed. What is the dose of the aspirin? Dose of the aspirin is around 300 milligram. You should take around 300 milligram aspirin to have a good effect, immediate effect. There is a difference and which type of aspirin you should take. In the market, actually, there are very prevalent aspirin brand which is known as ecospirin. So most of our cardiac patients are taking ecospirin. So ecospirin is good form of therapy, especially in chronic therapy. Suppose somebody is already having a heart disease, he already had a stent or already had a bypass or already has a chronic blockage. For that group of individual, for chronic therapy, ecospirin is good. But ecospirin is not very good form of therapy in acute management. Suppose somebody is having acute chest pain. For him, it is better not to give ecospirin. Why? Because ecospirin is enteric coated. That means ecospirin is designed to get disintegrated not in the stomach. It is designed to get disintegrated in the intestine. Why? Because to prevent the gastric irritation, because aspirin is proven gastric irritant. So in order to decrease or minimize the gastric irritation, aspirin is enteric coated, ecospirin is enteric coated, so that ecospirin or aspirin doesn't get absorbed from the stomach, it gets absorbed from the intestine. So it decreases the gastric irritation. But in emergency scenario, when you require the drug to be absorbed as quickly as possible, in that scenario, ecospirin is not a good choice. In that scenario, Dispirin is a good choice, because Dispirin also is available in the market. Dispirin is not enteric coated. That means Dispirin gets absorbed easily from the stomach. So absorption is faster. Dispirin absorption is faster compared to ecospirin. Ecospirin absorption is slower, although the gastric irritation is higher in case of Dispirin because it gets absorbed from the stomach. So in emergency scenario, when somebody is experiencing a chest pain at home, it is better to take a aspirin 300 milligram rather than taking an ecospirin, because the onset of action of aspirin will be much faster compared to ecospirin. So at home, number one, that you should have aspirin 300 milligram, and if you think you or any of your loved and near and dear one is having a chest pain which is could be due to heart attack, you give aspirin rather than ecospirin, and then dose should be 300 and it should be chewed. That is number one. Second is that if you are experiencing chest discomfort and if you are thinking the chest discomfort is probably secondary to cardiac or heart attack, you should give an sorbitrate, and sorbitrate also you should have at home. Sorbitrate is basically a tablet which has the capability to dilate the heart vessels. So thereby it increases the blood flow to the heart, and thereby it minimizes the damages to the heart. So sorbitrate you should have at home. Sorbitrate usually comes in 5 milligram or 10 milligram tablet. This 5 milligram also should not be swallowed like aspirin. Aspirin should be chewed, as I have told previously, while sorbitrate should be kept under the tongue. So you should keep one sorbitrate 5 milligram under the tongue. There are some precautions while taking sorbitrate tablet. What are those precautions? Sorbitrate has the capability to decrease the blood pressure. So that's why whenever you are taking sorbitrate, sorbitrate should be taken when the patient is in a sitting posture, propped up posture, not standing position. Because in standing position, if you take sorbitrate, there are chances the blood pressure will come down. There might be a giddiness and fall. So patient should sit or lie down and then take the sorbitrate under the tongue. And before giving sorbitrate, it is important to check the blood pressure also, because if there is a hypotension, if the blood pressure is less than 100 millimeter mercury, then sorbitrate should not be given. And another precaution is there while giving sorbitrate is that if somebody is on drug like Viagra for erectile dysfunction, sorbitrate should not be given, because there is a drug interaction between these two. So it can lead on to profound hypotension. That is something which is very important to keep in mind. If somebody is on a drug like Viagra for erectile dysfunction, he should not take drug like sorbitrate. So these are the three precautions we should keep in mind. Check the blood pressure. If the blood pressure is okay, then only give sorbitrate. While giving sorbitrate, patient should be sitting or lying down position. Sorbitrate should be given under the tongue, and it should be if the BP is bit lower normal, it should not be given. So these are the few precautions while giving a sorbitrate. There are other few do's in case of heart attack. Always stay with the patient and calm the patient, because if you, as a caregiver, if you panic, the patient also will panic, and chances of heart damage increases significantly. The risk of arrhythmia and complication also increases significantly. There are few do's and there are few don'ts also, which you should not do in case of heart attack. So what are the don'ts? Don'ts are: do not give anything to eat or drink if the patient is having a acute chest pain. That is number one. Second, don't ignore the symptom. That is most important. So most of us think that chest pain is due to gas, acidity, and tend to ignore the symptom. As we have discussed, time is of very important parameter out here. The more delay the treatment, the more complication, more death rate. So do not ignore the symptoms. Call for help immediately, because as the time progresses, the heart muscle damage increases significantly. So very active intervention is required. You should call for help. Do not panic. Ask for ambulance assistance. And do not let the patient drive to the hospital. Call the ambulance itself, or you yourself drive. Do not let the patient drive. So having said all those things, there are a few important cardiac emergency kits all of us should have at home. What are those? One is, as we have already discussed, the aspirin, especially in the form of aspirin 300 milligram, because it needs to be chewed, and which is one of the most important drug in case of acute heart attack, which improves the survival rate by up to 25%. Inexpensive but most important drug. Second, sorbitrate 5 milligram you should have at home. There are few precautions while taking sorbitrate that we have already discussed about that. Third, you should have a blood pressure monitor, because blood pressure, if it is on the lower side, you should not give sorbitrate. Along with the blood pressure monitor, you should have a pulse oximeter also, which monitors the pulse. So these are the few important cardiac emergency kits you should have at home, so that if in case the emergency strikes, you should make use of that, and do not delay, do not hesitate, do not overlook the symptom. Call for help, call ambulance, and go to the hospital as early as possible. So I hope all these tips would help you quite a lot, and thank you all for your patience here.